It's a people, it's a community, it's a life, it's a heart, it's a spirit.
Parents of gay children say, I want my son, my gay son, to have the same opportunity to come to me and say, hey Dad, I'm getting married, as my non-gay son or my non-gay daughter.
The heck would you want a picture of a tattoo of $1,000 on your penis for?
You might just need to satisfy yourself sexually alone at that point.
Do I regret it? Not one bit. Did I think that I would actually take it the next step and do it again?
And what goes into their life, how they handle it. There are 12 houses, and each one of those houses has a particular function.
Look into yourself, think about it, and just be whoever it is that speaks to you.
Hello and welcome to Talking About. Tonight we have a couple of very special guests, and we're going to be discussing a topic that has been very much in the news of late. We're going to be talking about drug-resistant HIV, superinfection, as well as some goings-on at the AIDS Center, Queens County, where my guests are from. And I want to welcome my guests, Ajani Benjamin and Jennifer Medina. Welcome.
Hi, thank you.
Okay, when people say drug-resistant HIV, superinfection, that immediately brings to mind, horrific imagery. Is that an accurate reaction to it?
Oh, what would you say?
I think that a lot in the media lately, there's been a lot of attention given to it, and the good part about that is that it's brought HIV back up again as a topic. And I'm glad that we're able to be here tonight to kind of shed some more light onto it. The resistant strain that's being talked about is an anecdotal case. There's really only one case in the city of New York right now, and it's currently under investigation. Because of that, there's a lot of fear around it because we don't know what's coming next. When it first came out, this was a strain of HIV that was resistant to 3 out of the 4 drug families, the drug classes of HIV. The latest update that we got was that the person is responding to some treatments, but he's still in intensive care and he's still going through a lot.
And I think also the differentiation that we have to make is the difference between what reinfection is and what is being called superinfection, or like the mega HIV. And reinfection occurs when 2 HIV positive people continue to have sex with each other without barriers, without using condoms or dental dams.
Okay.
And that's reinfection. They're reinfecting each other with their strains of HIV. So
okay, I think we might want to just kind of pull it back and backtrack to sort of a beginning overview.
Sure.
Because before you talk about superinfection and reinfection, you start with infection.
There we go.
Right.
So, exactly what is what's the difference between HIV and AIDS?
Okay, excellent place to start. HIV is the virus that causes AIDS, and essentially it's marked by the difference in terms of sickness, by how healthy the person's immune system is and how the person's immune system is responding to treatment. In a given milliliter of blood, we have anywhere between 600 to 1,600 white blood cells. They're specifically called T cells.
Okay.
And that's in a healthy person. With a person whose immune system is compromised because of HIV, when that number goes below 200, they're said to have an AIDS diagnosis. The other case that would change it from being HIV positive to AIDS is if a person is HIV infected and develops one of 26 opportunistic infections.
Only one?
Only one.
Classification?
That's right.
Only one changes.
Has that always been the case? Because
no, it wasn't always the case. At one point it was 2 and T cells under 200, but now it's either or. Either your T cells are under 200 or you've had one opportunistic infection, which includes Kaposi sarcoma, which is the lesions on the chest, which was very popular, very popular in the 80s, common in the 80s, exactly. And as we saw, and Tom Hanks had that in Philadelphia. Those were the purple lesions. So there are a few classifications of cancers and things like that. Cervical cancer within women is one of the OIs. So that is a classification that moves you from being HIV positive to being an AIDS diagnosis, which is the stage of the disease.
So is it safe to say that it's not HIV or AIDS that can actually kill somebody? It's one of the opportunistic infections.
That's right.
That really gets you.
The HIV weakens the immune system and opens it up to catching one of these opportunistic infections that usually a healthy body with a healthy immune system would shed. You could be, if you have a healthy immune system, you can be exposed to the virus that causes any of the opportunistic infections, but your body will shed it. If you're infected, immunely compromised really, then it takes hold, takes the opportunity, and then that can kill you.
Yeah, in 20 some odd years, I mean, it's really a sad state of affairs that we're still having to deal with it.
That's right.
And it's also unfortunate that not enough people are dealing with it.
Right. HIV kind of moved from a place of lots of excitement, lots of attention, to almost complacency, where people, there's been, different drugs came out in the 1990s, or late 90s. Protease inhibitors came out, and that really changed the face of HIV/AIDS. There was no longer a look for someone who had AIDS. Before, wasting syndrome was something that happened a lot, and now lipodystrophy happens instead. So the person, instead of losing weight, is now gaining weight. So the face of HIV/AIDS has changed, and people have almost become complacent, where they feel that I'm going to take this medication, and it will no longer be a concern for me. It's something I won't have to deal with. I'll just pop a few pills. That isn't the reality of it.
Do you mean to the point where people are saying that it doesn't matter if I take preventative measures, that it's just a matter of taking a few pills and I'll be okay?
I think that it's not at the forefront of people's minds as it may have once been. And the reality of it is that HIV doesn't exist in a bubble. Life happens, and unfortunately, HIV sometimes needs to be kind of brought into the ongoing life. But when a person becomes HIV positive, that doesn't become their life. Bills still have to be paid. The house, the roof over the house, taking care of kids still has to happen.
Right.
And a wise person has said HIV is only the tip of the iceberg. A lot of the people that we work with are dealing with a plethora of issues. We're talking about housing issues, substance abuse issues, mental health issues, economic issues. So a lot of times health is not the #1 concern for someone, even if they know their status. So what we talk about in our agency is the overarching message of prevention and keeping yourself safe, so that it doesn't have to become a part of that iceberg. And if you do know your status, is to get tested, to know your status, that then you can take care of yourself and make it a point of your life continuum, because it's important to know. And it's important to know not just if you're negative, it's just as important to know if you're positive, so you can continue to keep yourself safe and your partner safe.
Right. And you mentioned your agency, AIDS Center at Queens County.
Yes.
What is it? I mean, regular viewers of the show know, but for somebody flipping the channels, what's the AIDS Center of Queens County?
Okay. Well, the AIDS Center of Queens County is a CBO, which is a community-based organization. We provide services to people who are HIV positive, infected, and affected. So we have quite a number of services available for the agency, and we also partner with other agencies where we have memorandums of agreement to provide services to really the whole community of Queens at large, I would say, right?
Yeah.
The entire community of Queens. We have case management services. We're from the Education and Prevention Department. We also have legal services. There's a food and clothing pantry. There are housing services. There's needle exchange now. Yay, needle exchange. And what else?
I think you mentioned most of it. The idea is one-stop shopping for issues related to HIV. There's also primary care with New York Hospital
That's
Queens.
right, co-located.
So that a person can go to ACQC and receive a number of services, as opposed to having to go from one agency to the other. But as Jennifer mentioned, we do cooperate with other agencies. If there's something that a person needs to get and they can't get at ACQC, we're more than happy to make sure that they get where they need to go.
Okay, and this is focusing mainly on the community of Queens.
Yes.
Which is a very diverse community.
Most definitely.
Yes.
I believe it's the most diverse county in the country, if I'm not mistaken.
It still is.
And that has to present some barriers in and of itself.
I think the culture of ACQC is to be culturally competent. We have an agency that is representative of the community that we serve. So we have people of Asian background, of Hispanic background, of African American, of Caribbean, West Indian, African background. So we pride ourselves in the fact that we have an agency that represents the community as best it can. And there always are challenges in regards to if there is a person who comes in who does not speak a language that anyone in the agency speaks, and it's at that time that we use our networks within Queens to find appropriate services for that person who may need their services in a certain language that we can't provide for.
Okay. Just sort of getting back to focus, we sort of introduced HIV and AIDS. I guess start with prevention, I suppose, unless you can think of a more logical place for us to work from. But I mean, we've talked about HIV prevention on the show. What is being done now or not being done now that really needs to be exposed?
Okay. I think prevention is a really great place to start, because prevention is something that involves all of us, regardless of our HIV status, positive, negative, or unknown. And I think unknown is a status that a lot of folks don't really consider.
But it is a status.
But it is a status, and it's an important one, because it's a status at which a person has the opportunity to go and find out more information. With all the new information that's coming in, with this one case that's currently under investigation, what hasn't changed, what's remained constant, has been HIV prevention messages and techniques. My supervisor told me a story the other day about a condom that he thought was very, very colorful, very, very nice, and he's kept it since 1989. And the other day he opened it and realized that with one minor difference, the health messages were the same. So not a lot has changed. And essentially that is that a person, you often look at sex behaviors as being the risk, but the risk behaviors they include sex, exposure to a needle that's been used already, regardless to what the needle's being used for, receiving blood or blood products, and then being born to an HIV positive mother. Those are the four main categories that would put a person at risk. Essentially, the real risk are in the fluids. So that's blood, talking about breast milk, talking about pre-ejaculatory fluid, ejaculatory fluid, and vaginal fluids.
Vaginal secretions.
Vaginal secretions. But it's really important that people not get stuck on labels and get stuck on this particular group of people, because the fluids, HIV, they don't care who is doing the behavior or how the behavior is done.
They're just trying to find a port of entry.
They really are.
And I think that we all are the people. When people speak about those people, we are those people. We engage in those behaviors, and we all engage in them. And so every one of us has either vaginal secretions or ejaculatory fluid or pre-ejaculatory fluid. And so it's about the HIV, like you said, it doesn't care. It's a very fragile virus outside of the body. And we actually had this conversation with some young people today who were asking us the difference between hepatitis C and HIV. And HIV is a very fragile virus outside of the body. It does not live once it's had contact with oxygen. It does not live in dried blood. So it's just looking for a port of entry. It doesn't care how it gets in. It doesn't care where it gets in and with whom it's getting into. It just wants to get into the body to do what viruses does and to replicate. So I think that's our prevention message, is that we are all at a point that we're all susceptible if we continue to engage in risky behaviors without using barriers.
Okay. Somebody is diagnosed as being positive. What step do they take now? What is there immediately onto medications, or is there? I know it's case by case, but
right. There's a trend that's happening lately, and that trend is not to immediately put a person on medication. The reason for that is that over time, the medication oftentimes stops working properly, and a person needs to switch to another medication. So they delay treatment oftentimes until a person's T cells reach a certain level, or until a person's viral load reaches a certain level.
Is the medication stopping working, is that due to non-adherence to the medication schedule?
That can be a very big part of it, and that can lead to resistance. We'll probably talk about that a little bit later on. But medications just kind of run their course. Sequencing is actually something that providers do with their clients, which is the order in which HIV medications are taken. You want to take medication A before B, because you know what? If you take B before A won't work. Okay, and there's a particular order that the medication has to be taken in. When A begins to stop working, as in the person's T-cell level begins dropping or their viral load begins to go back up, it's time to switch to B. If a person waits too long, that can lead to resistance. And it's very important for a person after they've tested positive to have a primary care physician who is taking care of, an ID specialist, an infectious disease specialist who's going to be working with them first to get a baseline to see what is their level of viral load, and then to work out, well, what medications are we going to try and use to set a goal for your lowest possible viral load. After that, monitoring the person every 3 to 4 months to make sure that that viral load doesn't go up and the T cells don't begin to go down. That's if they're on medication.
And I think it's really important, especially if you're HIV positive, to have good communication. Have good communication with your provider, and to be honest with your provider, and to try to find a provider that's non-judgmental. If you're engaging in behaviors that you don't want to be honest about them with your provider, because if your provider knows that you're continuing to injecting, any substance. It can be if you're sharing needles with steroids, if you're sharing needles with insulin, if you're sharing hormones. As long as you're sharing a needle, you're still engaging in a risky behavior.
Okay, so can there be a mentality? Oh, I'm not a drug addict, so this needle doesn't make the difference.
And that's where we speak about that all the time. That it's not what you're doing; it's the vehicle. It's not heroin that gives someone HIV. It's the needle that holds that small amount of blood. It's the vehicle in which it travels. So anything that's housed in a needle can transmit HIV. Insulin, steroids, hormones, anything if anyone is sharing. So it's about being able to have an open and honest communication with your doctor, and where you don't feel judged and say, look, this is what's still going on, so that they can also provide you with services to maybe reduce your risk, which is what we call harm reduction, which is maybe enter into a needle exchange or reduce the number of times that you share needles with an individual. But it's all about the communication, because then that you can stay healthy in that manner. Because if you just sit there and just say yes, 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 okay, what you're saying is correct, and that's it, you've walked into an appointment and walked out and there's been no change, because you're not being honest with the provider, who can then maybe adjust things to make life easier for you in taking the A, B, and C regimen.
So to sort of boil it down to its simplest point, you can't get the answer if you don't ask the question.
Exactly.
Definitely.
Exactly. Most definitely.
Somebody comes into ACQC after just being diagnosed. What's the first thing that ACQC is going to offer them?
Oh, everything, usually. We have a lot. We have one-stop shopping. Probably the first thing that they'll come in for is case management. And case management is basically helping people get their lives back together, enrolling them for insurance, medical insurance, housing, substance abuse treatment if that's what they want. And really, case management and ACQC is very client-centered. So each client has different sets of goals. Some clients may come in and they may be HIV positive, but their first goal may be housing. I'm tired of sleeping on someone's, couch, and I've been couch surfing for the last 6 months, and I don't want to do that anymore. So at that point, the case manager would then say, okay, we're going to refer you to housing. Whereas another individual may come in who's just been positive, who's just been tested positive, and they may say, well, my first need is I need to learn more about the virus. And then they would maybe refer them to the Education and Prevention Department, where we would give them a one-on-one on what HIV is and what the medications are. So it's really client-centered as to meeting the client where they're at in regards to what their needs are at, and then going from there, taking the avenues from there to find them services. But usually it's case management, if not medical.
Okay. Then I guess back into the path of virus. I know I'm jumping around a little bit, but every time an ACQC question pops into my head, I want to get it out there, because there's so much information to get out, and we have a short hour to interact with the viewers. And I do believe we have a viewer on the line. Hi.
Hi, I'm just calling you because I think this is such a valuable show. I want to thank you for putting it on. It's very informative, and just want to say thanks. I think your guests are very well-spoken, and you're doing a great job. That's all I want to say.
Thank you.
Thank you very much.
Okay.
And any viewer can call in right now at 718-460-9899. 9802. We welcome any and all questions and comments. We just had a terrific comment from a viewer like you, so just give us a call. Okay, the path of infection leading to, unfortunately, reinfection or superinfection. Somebody is either working through the course of meds that you mentioned, A into B into C, which now it's a D. What are some of the factors that can lead to A not working, B not working, aside from just you've been on it so long that it's just worn its welcome out?
Right. You actually mentioned one of them already, which was a person not sticking to their regimen. I saw an ad that that was up. If I wanted to be told when to eat and sleep, I would have joined the army, because HIV regimen is very, very strict, and missing 2 doses, that can be it for that drug.
Okay.
And it's very, very important that a person try and stick with the regimen, including drugs where you have to eat with it, whereas others need to eat on an empty stomach. Whereas, where the drugs themselves have side effects that require more drugs to treat.
Okay.
Such, side effects like nightmare, like weight gain.
Okay.
Liver enzymes are increasing, things like that.
All things that have to be monitored. We do have a caller on the line. Caller, whenever you're ready, just jump in, ask your question, say hello.
Hello?
Yes.
The reason why I'm calling, I like the way you guys put out the show. It's like to give a lot of people experience out there, to let them know what is the virus is about.
Thank you. Do you have a question?
Yes, actually, I am a client for ACQC, and I know Jennifer Nadino. Hi, Jennifer.
Hello.
The question that I was that like she was mentioning earlier, that a lot of people coming in for their, for medical status, they're coming in for housing, which I've been diagnosed 4.5 years now, and I am on the medication and I've been doing pretty good. But the question that I want to ask, that how would they know if the patient is taking their meds regularly? Because some of them, they don't take it. They're taking drugs, they're using alcohol and all these stuff. But the job that they've been survived for all their clients, they've been doing a pretty good job. They help them out with whatever they needed, then do home visitation, and I was very happy and I'm pleased with it, to be with them for 4.5 years. Because I was offered if I want to come in and assist with them to help other clients who have these problems. But every time you go there, and it's like you want to try to sit and talk to somebody, they're just like, oh, they're only just keeping me here wasting my time. I need to get out of here. They out there in the street doing their own thing again. That's how it is. But it's very nice to have you guys on the show, and God bless you all.
Thank you.
Well, thank you. Is there any particular point that you would like to get out to our viewers as somebody who's used the services of ACQC and is living positive?
I would like to give this suggestion out to everyone out there who is watching this program right now, and they know that they were diagnosed. Let them continue to take the meds, because that's their #1 goal. And it's like everybody know that they have it, and it's only a 50% chances. The meds is the one that's let everyone to know how they're doing, because if it wasn't for the meds, a lot of us would be die already. So the most important is that they had to focus on their meds. The meds come first. They follow up with their doctor. They do what they have to do. They go, take family counseling, who have family. They're single, male and female. Then go and they follow up. All this thing is more important, that you're going to get it done. Because if you don't do it, you're not suffering the people, you're suffering your own self. Right. Because you are the one have to get out there and get what you want. Because it's the same that before you was not diagnosed, you were a normal person like human being. And you are still a normal person like human being till now. But sometimes a lot of people who have it do not want to come out and tell their family members and tell, let the whole media know, well, okay, well, I have diagnosed with HIV or what's not. They keep it into themselves. And they still move on as a normal person, do what they have to do. They do what the doctor has told them to do. And they move on with their life. It's just another day, but you just have to follow up with the instruction that you get.
Right.
And the most important thing is the meds. The meds that come first. You follow up with your doctor, you follow up with a case manager. And from there on, you feel like there is nothing wrong with you. Because which you know that you have it, which you know that you have it, but you do not let it bother you. It's just like maybe some people may have cancer, some people may have brain tumor, and they figure out, oh, I'm going to die today. What the hell? I'm not going to take the meds no more.
Right.
No, you can fight it.
Well,
because there is a lot of chances out here that you could fight, and there is a lot of things that you could do to make yourself happy. You do not have to let anything bother you, because it's just one straight road that you have to put your head on and walk. God do not like ugly. God like all his children equal as they are. It could be they're gay, they're straight, they're a lesbian, or what they are. Because if you cut each and every one of them hand, you will find the same blood. It doesn't have pink, white, or yellow.
Right.
And everyone who is watching the show that I'm saying here right now, everyone needed to be treated equal as a human being.
Okay, and I really want to thank you for your input, and we appreciate your call.
All right, then.
Thank you.
Thank you. That is somebody with a very healthy attitude, it would seem, and somebody who is fighting a good fight. Is that a common thing that you see with the clients? Do people?
I would say, yeah. I think the one thing that people realize once they come to ACQC is they come to an environment where people are not scared. And they've dealt with stigma, they've dealt with things in their family, people giving them plastic spoons, plastic cups, plastic cutlery, and I think that they walk into an agency where from the get-go, from the receptionist to the ED, to the executive director, they find people who are not afraid. People who are not afraid of hugging them, of giving them a kiss hello, of asking how they're doing. They walk into an environment where people are friendly, people want to hear what's going on in their lives, the good and the bad. And if there is the bad, then to try to help them to fix it and start them down the road to fixing it, even if it's not fixed for a few years. And I think that that's the difference. It's the environment that's fostered within the agency in that they find acceptance and when they walk in. There's no, HIV is not an issue when you walk into ACQC. Hugging you, sharing a slice of pizza, having luncheons for the clients. Everything is done there with an attitude of joy, and just being happy to help people and being able to deliver services in a kind way. A lot of times people have been to dentists, to doctors, to even other agencies, and their experience wasn't pleasant. And they, not that things are always like happy-go-lucky, but it's the fact that, there is a place where people feel safe. And, I know that AJ has experienced this, I've experienced this, where we've had a client who was in severe crisis, and the first place they came to was ACQC. Even though they could have gone home, they could have gone to a friend's house, the first place they came to in their state of crisis was ACQC, which means a lot to us, because not that we want everyone to come always in crisis, but that, they trusted us enough to come to the agency and seek assistance. So that is really great.